The research study titled Desires for Care and Access to Services Among Transgender Persons in Guyana was launched on Tuesday via an online press conference to commemorate Trans Day of Visibility, which is observed every year on March 31. The focus of this day is to celebrate transgender people and raise more awareness on the discrimination they face in society. The study did not indicate any new information regarding what trans people face, but rather reaffirms the fight for equal rights to basic human services such as access to education, employment and opportunities, access to public services and spaces without any form of discrimination or barriers. Managing Director for the Society Against Sexual Orientation and Discrimination, SASOD, Joel Simpson, said the 3-month study is the first of its kind in Guyana and the Caribbean. He noted that there is no real research or data on trans people issues in Guyana and the Caribbean. As a result of the study, Simpson said an action plan was formulated.
So HIV services and healthcare is obvious one. Including the national HIV response and inclusion of trans persons in global fund processes. Gender affirming care, specifically working with medical providers on providing gender affirming care. Legal services, which is an area that still needs to be expanded. Access to education, some of the socioeconomic issues are covered as well thematically. Employment and entrepreneurship active opportunities. Access to public services and spaces. We spoke a little bit about the discrimination that often occurs in accessing public space and public services. Organizational changes, and that term is used broadly at the level of community-based organizations, civil society organizations, government institutions, in particular state agencies, and even donor and technical partner agencies about how they deal with and include trans issues in their programming.
Consultant and co-author of the study, Alessandra Herman, noted that while conducting interviews, persons were generally confused by gender identity, gender expression, and sexual orientation. Herman said almost everyone interviewed was discriminated against when seeking employment, health care, and using the public transportation. It was noted that persons in the trans community are also oftentimes harassed by the Guyana police force.
A qualitative methodology was adopted for this study. Semi-structured interviews were conducted with 22 trans and gender non-conforming persons from 4 regions in Guyana, along with stakeholders interview, to gain a better understanding of service barriers encountered by trans persons and subsequently help guide programmatic decisions. All interviews were transcribed, coded, and analyzed thematically.
Factors which increase violence and discrimination include persons being rejected by families and communities, persons engaged in sexual work, moral and religious beliefs, and ignorance within the public domain. Herman spoke about the recommendations coming out of the study.
Suggested strategies that can be used to change this present narrative in our very local context. For example, education and training of service providers across all sectors in gender and sexual diversity. Training of trainee nurses, police officers, teachers, and medical and law students in gender diversity and sensitivity and inclusion before they venture out into the service industry. Also, there should be non-discriminatory policies at institutions and redress mechanisms where people have a sense of justice and people are held accountable for their discriminatory actions. Amendment of legislation to prohibit discrimination in employment on the basis of sexual orientation, gender identity, and expression. And finally, a recognized need for capacity building and empowerment sessions for the trans community members to address intergroup and interpersonal issues within the community itself.
The study reiterated the global narrative that trans people remain one of the most marginalized groups in society. The study was done in collaboration with the Guyana Trans United, the Caribbean Vulnerable Communities Coalition, and the Ministry of Public Health's National AIDS Program Secretariat. Reporting for the newsroom, I am Isanella Patwo.